This video will show the clinical user how to document a discharge summary. The purpose of a discharge summary is to end a patient's episode of care, to notify the prescribing physician of the patient's clinical status at the time of discharge, to recommend continuing services when services are still recommended, and to provide guidance in the event that clinical concerns arise in the future. A discharge summary is needed when a patient's skills are within normal limits or when the highest functional levels have been achieved. However, a discharge summary can also occur due to attendance issues, lack of progress in therapy, the patient moving out of your service area, the patient no longer desires to receive therapy, etc. Whatever the reason for the discharge, it should be communicated clearly and professionally on the discharge summary in ACE. This will automatically be sent to the patient's physician after the clinical user has signed the document. A discharge summary is initiated from the patient section. Tap on the name of the patient that will be discharged. The patient record will default to open to the Documentation tab. Tap the button for Discharge Summary. ACE will alert the user that all documentation for services delivered to the patient should be completed prior to writing the discharge summary. After completing the discharge summary, the clinician will no longer have access to the patient's record for the purpose of documentation. The user should tap Yes when they are ready to proceed with writing a discharge summary. The user next selects the date of the clinical discharge. Typically, the user would select the last billable date of service provided to the patient if it was the final visit. This may or may not be the date that the user is actually writing the discharge summary, so this should be considered carefully. The calendar on this form is an active calendar, meaning that the user can tap the date from the last clinical service to change the date. ACE will automatically display the short-term goals from the patient's current plan of care. The user will enter the current level for these goals as of the last date of service. The user will provide a written narrative explaining the reason for discharge from services. Whether the reason is successful therapy or the patient's attendance record, the therapist will provide the information in the space provided. If continued services are recommended, the clinical user should make note of the need for continued services. The user will provide any recommendations following discharge. ACE will provide a preview of the discharge summary for the clinician's review. When the user is satisfied with the document that will be filed in the EMR and sent to the physician, tap Continue. On the attestation and signature form, the user may either sign the summary or edit the summary as desired. Upon choosing to sign the discharge summary, ACE will alert the user that when the summary is signed, the user will be unable to complete any other documentation for the patient. In fact, when the discharge summary is signed, the patient is removed from the user's patient list, and the status of the patient is changed to Discharge Pending. When the user is confident that all services have been documented, tap Yes to proceed. Enter your ACE password and then tap Sign. ACE will alert the user that the document has been signed and filed in the patient's EMR. ACE will also remind the user to sync their data so that this discharge is reported back to the administrative portal of ACE, the mothership. This ends the episode of care for this patient. If the patient later returns to the practice for services, a new episode of care will be initiated. This concludes the discharge summary instructions for ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.